Well, if you are a vaccinated family, please don't ostracize your unvaccinated family as evil or bad or not worthy of connection. All human beings deserve connection. So I would just encourage families to be creative in how they can get together safely, whether you're vaccinated or unvaccinated. The Omicron virus appears to be very contagious.
Warning, censorship.
When it comes to the sweeping mandates being handed down by public health officers across the country during this Christmas break, don't let the Grinch steal Christmas. Now, it's not me saying that. It's a concerned psychologist out of British Columbia, one who prefers to stay anonymous. Now, I've connected with this individual who wrote a very comprehensive letter, but they were not alone. A group of other psychologists are in agreement with the letter, one whom I interview in this report. Her name is Dr. Carole Anderson. She is a registered psychologist as well in BC who helps people through therapy with matters of depression, abuse, self-esteem, anxiety, relationship issues, stress, and trauma. Anderson feels vulnerable about doing this interview, but feels it's very important, almost critical, to do so. I'll highlight just a little bit the beginning of the letter, but you can find the full written letter at our website, rebelnews.com. You can click on the link in the description below to find it, or search the title you're seeing here on that site to find it. Dear fellow Canadians, did the Grinch steal Christmas? In recent weeks, BC's public health officer, Dr. Bonnie Henry, stated that British Columbians should only gather with safe vaccinated people over the holidays, implying that unvaccinated individuals are unsafe and should be excluded from all social and family traditions and activities. On December 17th, she took this step further, ordering British Columbians not to gather with family and friends who are unvaccinated, thus making social exclusion and marginalization of unvaccinated individuals a public health order, separating friends and families just before the holidays until the end of January. At least. You're not going to want to miss this report, and you're going to want to share it. You never know which loved ones on your social media are starving to hear this information during these challenging times. Before I cut to the interview, I want to let you know that you can do something about the two-tiered society that is happening and becoming normalized in Canada. If you go to our special website called fightvaccinepassports.com, there you can join our fight, our legal fight that we've teamed up with the Democracy Fund to take on over 20 cases. Some are actually cases challenging the government, like in BC, for their tyrannical vaccine passport system that prevents people like Lee and Nilison, who is unable to get the vaccine for health reasons, from being able to go and have dinner with her vaccinated family. And we've also taken on many cases across Canada of jab or no pay mandates that have left people without a paycheck because they are unable to or unwilling to get these vaccines just before Christmas. Again, you can donate at fightvaccinepassports.com. Every penny there goes to pay the legal fees. None of it goes to Rebel News. And it also makes these plaintiffs be represented at no cost to them. We appreciate your support.
We have been particularly concerned about the mandates that are coming down now that divide and separate people and families, people who have strong emotional connections and bonds together. And that is just of huge concern to us, to have a whole group of people who are unvaccinated marginalized in that way. Again, not that it's anti-vax, that's not what it's about. It's about how important are connections and how much being bonded to one another, connecting with one another, how important that is, especially as we go into the holiday season.
And talking about that, one of the things that comes up in the letter is the concept of attachments and how important that is. Do you want to explain that a bit?
Yeah, attachment just has that idea that we are bonded to other people and that is the very soul of what makes us human. And that starts right, the phrase was used from the cradle to the grave, that starts right at conception through to birth, but is important all the way through to the grave. So that includes our elderly people who have been in long-term care, who also need to stay connected.
Well, we have seen in the past that what looks like COVID-19 restrictions to protect the elderly in homes in certain places in Canada, it was kind of the opposite. It was neglect that led to some of the deaths. I'll show an article here for that. Now we're hearing in at least one province that unvaccinated grandparents in homes are being told that they can't go home and visit family for Christmas. I know that the letter touches on the word dehumanization when it comes to the unvaccinated. So could you speak in on that a little bit as far as the policies that you see sort of two tiers? It's a little stricter for unvaccinated people as well.
Well, obviously, if you are a vulnerable person, you may need extra protection. But just because you're unvaccinated, I'm not sure that really means that you should be disconnected from those people that are important to you. That the idea of we're in this together and how do we protect each other together is the message that that's the real message of attachment, where you bond when you are together. And throughout this pandemic, it has seemed like there has been lots of things that isolate and separate. And so creating two groups of people, two class system where certain people have privileges and others do not. And it appears from the research, this is outside of my expertise, but it appears from the research that and what we can see is that everybody is passing this virus. Nobody is immune from this virus. And so that's where good public policy comes with good debate. And we would like to add the debate of how does attachment fit into the narrative of COVID and how we manage this virus that is unrelenting.
Yes, we've seen examples of that, vaccinated sports teams catching the virus, restaurants that are checking for the passports, having, 40 something people have the virus after attending the restaurant. That term, we're all in this together, was a very popular term associated with COVID-19 in the beginning. I've done a lot of reports with unvaccinated healthcare workers or healthcare workers that didn't want to participate in the system and give their vaccination status, who went from being, last year's heroes to this year's zeros. And a lot of them have told me, off camera, that themselves and some of their colleagues are really, battling depression now, suicidal thoughts. Have you noticed anything like that in your experience working as a psychologist, or heard about it in the community that you are talking with psychologists?
Yeah, absolutely. In my own practice, in the very beginning of the pandemic, I was actually horrified. I just wanted to say, no, please don't do this, because I understood the importance of human bonds. I realized that we were in a pandemic and something needed to be done. But the first thing that I noted is that especially in people who lived alone, some of my clients who lived alone, incredible distress as they were cut off from people around them. If you were fortunate enough, so if you're privileged enough to have strong emotional bonds around you, you might have done okay in those beginning stages. So that was the beginning. And then more recently, I have just noticed the distress, sometimes weeping for people who are feeling separated from their family. And certainly suicidality comes along with that. That purpose and meaning in life come when we are connected with each other.
Well, we saw, especially with children during the lockdown, when the schools in particular were closed, crisis centers in Canada for youth skyrocketed as far as suicidal and child suicide deaths went up. In BC, in last year, I did a report after we had filed an ATIP for more information that showed in 2020, actually, our hospitals were more overwhelmed with overdoses in British Columbia than they were with COVID-19. COVID-19 patients. And in the 3 or 4 months, you can find, I'll link this in the written report, but in the 3 or 4 months that followed the beginning of the lockdown, I believe it went up over 58%, the overdoses. What's your experience this year in 2020, or again, the community of psychologists that are talking about these types of things as far as substance use and the correlation with mandates?
Well, I'm not an expert in substance use or in suicide, but I think that what we do know is when we have attachment voids, when we have disconnection, that it's incredibly emotionally dysregulating. We feel dysregulated, and that's what increases the stress response and ultimately leads to all kinds of health conditions and ultimately begins the death process. But I think that alcohol and any kind of substance is something that people use to help them regulate their emotions when they feel that they are absolutely overwhelmed and disconnected. It fills a hole or it fills a void. So I think that's what we're seeing in those numbers, is that it's just emotionally distressing to be disconnected from other people.
Now, one of the things that I wondered early on is, you see these health professionals, which is great, that are put in the position to make these decisions. But I was surprised actually that there was no mental health professional that we see. I would have liked to have seen something like that. What advice would you have maybe in that department if you could give any advice to the government in that area?
Well, I would just love to see an epidemiologist, an economist, a sociologist, a psychologist come together to debate public policy and debate how we can keep people safe. How can we keep people emotionally and relationally safe because of what we know about attachment theory, but we also have economy, and we also know that this virus spreads through contact with people, and all of that needs to come to the table so that we can keep everybody safe and keep our most vulnerable safe, and that includes attachment, that includes relationship, that includes connection with other people.
Well, I got to tell you, it was refreshing to hear from psychologists who have been on the front lines mental health-wise during life with COVID-19. If you appreciate that here at Rebel News, we were able to give Dr. Anderson and the other psychologists she represents a voice, then you can consider supporting our independent journalism. We are independent from government interests. We are reporting for you. If you want to help support us, you can do so by donating at rebelnews.com/donate. I'm Drea Humphrey, and this is Rebel News. In case you missed it, you can grab another device or open up another screen and head to fightvaccinepassports.com. Join us in ending this medical apartheid in Canada.